We are basically going to focus on Unani medical tourism. You all are aware of what Unani is. It refers to an ancient Greek system which was originated in Greece 2500 years back. Then it traveled to Persia, where it is known as traditional Persian medicine. Then it went on to Arabs, where it is called Greco-Arab medicine, and from there it traveled to India, where it is known as Unani medicine. It is basically based on the four mizaj and akhlaq, and on the teachings of physician Hippocrates, who is known as Bukrat, and physician Galen, who is known as Jalinus in Arabic. It is basically based on the humors of a person. So I think you all must be aware, because most of you are PG students, and how this system is based on the temperament of each individual. So I won't go into this detail. It includes use of allatives, accelerants, aphrodisiacs, organ-specific tonics, and immune modulatory drugs, temperament-specific drugs. Basically, the whole system depends on the mizaj of a patient. So all these drugs are based on the temperament of a person. So we have cosmeceutics, nutraceutics, aromatics, and corresponding therapies are also integral important part of treatment of Unani system. In a nutshell, Unani system takes care of the human body in a holistic manner. So this is what we are going to focus on today: Heal by Unani Wellness Tourism. Uh, as we all know, that due to the modern lifestyle disorders, a lot of, because of everybody wants to do something very fast. So basically, he's under a lot of stress, and this is a part of the modern lifestyle disorders. And everybody, I think, I would say 90% of the population is under some type of stress and tension. So this in turn takes a major toll on your health. Maybe it goes on to you get depressed, you may have diabetes. So a lot of issues are related to stress and tension. So a relaxed mind is basically, we're going to focus on a relaxed mind is necessary for a healthy body. To get rid of the stress, taking a vacation occasionally would be a good idea. So hence, while on a vacation, if you get an effective, safe, and pocket-friendly treatment or health-promoting regime, it would be an icing on the cake. Why only India? There are many destinations. So around 4 million people are coming to India every year for Ayush treatments. Unfortunately, currently, people are aware of the Ayurveda system. We have to make Unani more aware in the international market, because people know what Ayurveda is, but unfortunately, Unani people are not aware, maybe because of the nomenclature. Recently, I was in Iran, and where this is known as traditional Persian medicine. And if you go into, let us say, Pakistan, it is known as Eastern medicine. If you go into South Africa, it is known as Tib medicine. So this is unfortunate for the system, because Ayurveda is known as Ayurveda throughout the world. And Unani, it's the same system, but it has a different nomenclature everywhere. So we have to inform the public or the international persons who want to come into India that Unani is this type of treatment. So India, basically, if you see, it is blessed with varied climatic zones and topography, having forests and mountains, deserts and seashores. And India is famous for providing the best medical services and Ayush treatments with state-of-the-art technology. And in India, we have highly qualified and skilled Unani doctors. So the types of treatments that can be offered. See, Unani system of medicine has various modes of for treating an ailment depending upon the nature of the ailment and its causes. We have Ilaj bin Tadbir, which is the regimenal therapy, Ilaj bin Ghiza, dietotherapy, Ilaj bin Dawa, pharmacotherapy, and Ilaj bin Yad, which is surgery. Ibn Sina mentioned 44 regimens in Al Qanun fil Tib. This is a famous book. We all must be aware of this. Canon of Medicine, Al Qanun. These are the diseases, the regimens that are mentioned in Canon of Medicine. Dalk, Takmeed, Nutul, Hammam, Ghusl, Hijama, Fast, Taliq al-Alaq, Qai, Tariq, Qai, Idrar Bol, Ishal, Riyazat, Tukna, Nushuk, Pashoya, Tanweem, Tadheen, Bakhur, Zarawar, Saqub, Takor, Tanafiz, Imala, Ilam, Abzan, Shiafat. Uh, Normally, we all are aware that the only method of treatment in regimen therapy is hammam, but there are so many therapies that we can, start our center with. Sorry. And zamad, nafukh, inkabab, lakhlakha, shamun, wajur, sanoon, tamrikh, qol, barud, tila, fatila, mul. Farzaja, tagriq, saud, gargara, khairuti. So these are so many methods, and even besides this, there are a lot many therapies also. The number goes up to about 99 or 100. These are the therapies that are mentioned in Al Qanun. So I'll just give a brief explanation of the major therapies. This is Dalk, which is a massage. There are two ways of doing it. One is with a soft hand, which promotes sleep and has a very relaxant effect. And surprisingly, if with the soft massage, a person can even go to sleep while the massage is being done. A dry and a hard massage is deobstruent and increases the blood supply, while the massage with oil relaxes the muscles and softens the skin. This is takmeed, fermentation. It is a process which keeps the body or part of the body warm. It is a therapeutic application of warmth and moisture, basically to relieve the pain and stiffness. It can be done after massage therapy. It is normally done after a massage therapy. This is Natul, which is irrigation therapy. It is an ancient healing technique that is used to cure eye and neurological issues like anxiety, depression, stress, memory loss, certain skin problems, gray hair, sleeping problems, migraine, and some types of allergies. Liquids such as warm oil, milk, buttermilk, or even just water, depending on the issue needing treatment, are poured over the patient's head. They are poured directly on the head. Hammam, this is the Turkish bath. It is useful for enhancing nutrition, adjusting the body fat, dissolving the waste matter from the body, providing heat to the body, and to initiate sweating. In normal health, a cold bath is preferred. However, to cure ailments like paralysis, a hot bath is highly effective. We can even add flowers, different types of flowers in the water. The procedure of this hammam is that first you go into a normal room temperature, then you go into this hammam, have a bath, then come back into a cold bath, and then to a normal room. So this is a process where three or four rooms we have to pass through. This is a normal ghusl, bathing. It is with a normal room temperature. A hot bath is where herbs are added. After a massage is generally indicated in patients with paralysis and muscular wasting. Cupping, we are all aware of this. We have two types of cupping, bil shart, which is wet cupping, and bila shart, which is dry cupping. Besides this, we even have fire cupping. Then this relieves local congestion. It is also useful in musculoskeletal disorders. It is effective in various female and male sexual disorders, autoimmune diseases, psoriasis, eczema, urticaria. This is Fasad venesection. It is type of bloodletting. According to Ibn Sina, it is a complete way of evacuation in case of congestion of humors. The process of evacuation is completed once the optimum level of humors in the body is achieved. It is useful in these corrects the excess blood, relieves high blood pressure, stimulates the metabolic process, amends the temperament of the patient, helps treat amenorrhea, helps in excretion of waste from various parts of the body, prevents the toxicity of the blood, and avoids accumulation of waste. This is leaching, taliq al-alaq. Leach application is unique method for the removal of morbid matters from the blood. It is useful for skin diseases, baldness, and ringworms. One precaution is that the leech should be only used. One leech should be used only for one patient. I mean, please do not use it on a multiple number of patients because you can get contamination in this. This is tadheen, oiling. This is basically where medicated oils such as Rogan Babuna, Rogan Kusht, Rogan Malkangni, Rogan Seer, Rogan Kaddu, Rogan Kahu, Rogan Banafsha, etc. are locally applied on an organ. This regimen is recommended to relieve pain, to improve nutrition of skin, and to divert morbid matters from the diseased parts of the body. All these oils are Unani. Then this is Saku, which is spraying. This regimenal procedure is performed usually over the head or some other parts of the body. In this regimen, medicated decoction or plain water is sprayed from a close distance to the affected part to disperse the morbid matters. Sometimes it is performed to change the temperamental state of an organ. In kebab, which is steam, this therapy is form of steam application where the over the affected parts of the body. In this regimen, some herbal drugs are boiled into a vessel and the steam is applied to the body surface. Steam application with decoction of khashkash seeds, banafsha, dhania, chopchini are useful in the treatment of earaches. Steam application with decoction of neem leaves is also beneficial in the treatment of earaches. So there is a significant effect of steam application with decoction of Alice flowers in combination with massage cupping in a case of non-specific low back pain. The foot bath, Pashoya. In this regimen, the foot is immersed in medicated decoction of the treatment of various bodily ailments. Foot bath in the decoction prepared with babool leaves, jaw ka atta, gule khatmi, mako, banafsha flowers, and gule nilofer is effective in cases of severe headache and insomnia. So you see the treatment of the foot, it goes up to for all the ailments of your headache and insomnia. So this is the Pashoya. This is Kai cauterization. It is an ancient medical practice that is performed with a hot iron or a caustic, to burn a body part that is not required. This practice is quite useful for treating soreness of the hip joint. Kai eliminates and resolves the pathogenic matters that are attached to any particular structure. Also, it strengthens the organ that possesses a cold temperament. Moreover, Kai retains the blood flow, thereby stopping hemorrhage. This is Abzan, sits bath. This is one of the types of bath in which lower part of the body, especially the buttocks and hips, are immersed into plain or medicated water. Better is to immerse it into medicated water containing different types of herbs. Again, depending on what ailments that the patient is, uh, accordingly, the herbs are used accordingly. It is very useful in the treatment of intestinal, rectal, and anal, prostate, kidney, urinary bladder, urethral, testicular, vaginal, and uterine diseases. Majusi and Ibn Sina have advised that the hot sizz bath is useful in cases of difficult labor. So there are four types of sitz bath, that is cold, hot, moderate, and compound. That is, we have an alternate hot and cold bath along with decoction or infusion of herbs that are commonly given for treatment purposes. Reek, which is also called sweating. It is a kind of evacuation of waste products from the body through sweating. This is achieved through certain processes such as hot fermentation, hot bath, poultice, exercise, massage, inhalation, etc. And also used by using certain drugs internally. This regimen is also useful to reduce body temperature in case of fever and to increase nutrition of the skin. Yes, eye vomiting. Emetics are used to cure headaches, migraine and tonsillitis, bronchopneumonia, and also bronchial asthma. This regime also cures mental diseases like mania and melancholia. Sometimes this regimen is useful in healthy individuals for prophylactic purposes to clean the stomach. Normally, we put salt on both fingers and put it in the mouth so that we vomit and all the bad matter from the system gets out. Even a healthy individual can do this. This is idrar ebol, diuresis. Aspurgation. Purgatives and lactatives have been widely used by the Unani physicians for intestinal evacuation in certain diseases. This method has antispasmodic and detoxicating effects. This is a normal exercise, which riyazat, which everybody knows that is very important for all of us to maintain our health. In the diet therapy, every patient is advised a diet accordingly. Even if you go in for a medical tourism, the diet chart is maintained of every patient according to his needs, and the sometimes the patient are asked to restrict the intake of food. A balanced diet is suggested for malnourished patients. In cases of weakness of certain organ, intake of the same organ from animal sources are advised. That is, in the weakness of liver, patients are advised to have liver from livestock. So this is a very important part of the medical tourism. That when a patient comes, his diet chart is maintained and he is given food accordingly for the number of days that he stays in that wellness center. Pharmacotherapy drugs of natural origin are used. They may be of plant, animal, or mineral origin. Single drugs as well as compound formulations in the form of safuf, haboob, kurs, kushtajat, sharbat, majun, itrifal, khamirajat are used in the treatment of various complex and chronic disorders. Along with the regimens, the patients are advised certain medicines also. So we have these kinds of different compound formulations, whether they are classical products or proprietary drugs. Surgery is the fourth line. I won't go into this. The purpose of Unani treatment, basically, it is to prevent illness, promote health, heal the sick, and preserve life. This can be summed up as follows: to protect health and improve quality of life, to eliminate diseases and dysfunctions of the body. Through these Unani therapies, we can attract foreigners into India for medical tourism. Recently, I was in UAE, where there is an exam that is conducted by the Ministry of Health, Abu Dhabi, every 6 months for Unani graduates. And once you get the permission, when you pass that exam, then you're allowed to practice in UAE. Unfortunately, no, the approval of Unani medicines have not taken place there. So most of currently there are 38 approved practitioners of Unani in UAE. Some are practicing there, some are in India, who occasionally go there and come back. Uh, Only two are actually practicing Unani, and the rest are having their spas, working in the regimental therapies. So you see the scope of this regimental therapies in even UAE. Plus, there are spas where in UK where all these regimens can take place. Some countries do have restriction on taking out blood. So hijama, cupping cannot be done there, or first cannot be done there. But the other regimens can easily be undertaken in these countries. This is a website that you can go through, uh, healbyindiaunani.com. Thank you. It's a very small presentation. Though I was given more than an hour, so I could not do much on this topic. Basically, I may even add on if the organizers allow me.
Okay, sir, go ahead.
I'll give my another slide, which I can, present on other opportunities what the Unani graduates can do.
Okay, sir, go ahead, sir. We'd love to see that.
Thank you, sir. You have rightly said that a relaxed mind is necessary for a healthy body.
If somebody has any question, can ask me.
Especially the fresher batch, if you have any kind of questions, you can ask him. No questions? This is giving the impression that you have understood everything said by our guest speaker.
Yeah, please. Now I'll go into this market of Unani medicines in India. That's one chapter I said about Unani medical tourism, which can be a good business opportunity for all of us to get uh, patients from India as well as from the international market. The other is the market of Unani medicines, where we can even have an opportunity of manufacturing, going into the manufacturing business of Unani. You see the market size of Unani is 51,500 crores. It was in 2001. Now it is 1,50,000 crores. It is expected to go to this figure by 2027. This figure includes medicines, nutraceuticals, dietary supplements, and herbal personal care products. Because there's a major market of now coming up of these dietary supplements and beauty care products. So that's also a major market that we can capture. However, Unani's share in this is not even 0.5%. This is, but even if we calculate 0.5%, it's a major share. Sales wise. Why is it limited to 0.5%? Maybe because we are thought to be confined to one community. Not that non-Muslims do not use Unani, but the problem is availability. We see all the clinics that are being opened are concentrating on the old areas of the city where Muslim population is there. This is one disadvantage that the Unani has. But now with the online marketing, we've noticed even in if we Amazon or other such websites that non-Muslims are preferring to buy online. The sales of our products are more to non-Muslims than in Muslims online portals. Lack of government support, we all know about this. Lack of innovations by by manufacturers, but still opportunities are in plenty. Manufacturing, we are covered under the Drug and Cosmetics Act 1940. Minimum area that is required for starting a manufacturing unit is only 1200 square feet with separate partitions. And in this 1200, we get one, you can say, one section. Sorry, one section. That means if we want to manufacture only safoof powders, then we require 1200 square feet. But if you want to add some other, then for distillate, we need another 100 square feet in that area. We have to add. If we want to manufacture hubs and pills, another 100 square feet has to be added into that. These are the machines which I will skip. Safoof 200 square feet. All these requirements are according to the GMP schedule mentioned in the Drugs and Cosmetics Act. You want to add oil, 100 square feet. For ointments, another 100 square feet. For pushtas, another 100 square feet, and so forth. And they have mentioned the minimum area for each and every section that you want to add into it. These are all categories mentioned in the GMP. Schedule E, it is called. This is the manufacturing area where minimum requirement is 200 square feet. This is again out of the 1200 square feet that I had mentioned earlier. The machines are slightly for bigger units. So manufacturing syrups. This is a condenser. The filtration of all syrups. This is the automatic filling line of a syrup. This is a cone blender for capsules. This is a loader where we put the empty capsule shells. This is the filling, manual filling. This is a semi-automatic capsule filling machine. We need a testing lab. Again, the size of this lab has to be 150 square foot. And this again is included in the 1200 square feet initially that I had mentioned. Now, the technical staff. You need 3 employees for starting a unit. One would be to test the product, a biochemist or you can say a biological person or a chemistry person. One from the BUMS. So one identifies, one tests, and one manufactures. So this is basically what we need. A Hakim who's registered